Hi there, happy Tuesday. Sorry I'm a little late tonight. I have been working nonstop on a project, and so I was like, oh, I gotta get going here. All right, well, tonight we talked about female fertility last week, and tonight we're gonna talk about male fertility, and we'll see where that leads me and where it takes me, and we might continue on this trend next week. Let's see what happens. So with male fertility, sperm takes 72 hours to mature, and it requires a temperature that's 3 to 4 degrees below body temperature. So this is perfectly suited for the male anatomy, right? And sperm can only usually survive a few hours unless the woman has fertile fluid, then they can survive 5 days. Whoops, sorry about that. Now, we need to know a little bit about male fertility and sperm, because if a couple is trying to have a baby, you want the guy to get a sperm count right away, all right? Don't wait. I mean, don't even start trying until you know what you're working with for the male, because remember, about a third of the cause is due to the male, and a third is due to the female, and then a third is the couple together or unknown causes. So why not out of the gate? It's a simple procedure, a simple deposit, and then you will have information, because if there are things going on with the guy and you don't take care of them, then you could be trying and trying and trying and trying. So just do it right away, all right? It's easy. So you've got to have, at least for sperm, a low sperm count is considered less than 50 million sperm per millimeter. Oh my gosh, I can't talk, sorry. Or less than 39 million sperm per ejaculate. So they're going to do this measure. You have to have a certain amount of sperm, but also the shape needs to be right. So there's a head and a tail and a body. And if the shape is weird, then that's going to be a problem, because those are going to be defective sperm. We don't want them to have like two heads or two tails. And then there's the motility. So this is the swimming aspect, which is usually garnered by the tail. But also there's an energy center in the sperm that drives that tail to move. And if the sperm doesn't have enough energy, it's not going to be able to move. So we want a sperm morphology of 50 to 60% and a sperm motility, again, of 50 to 60%. So those are just some basics that you have to have if this is going to happen naturally. So what might be some causes of male infertility are low sperm count. I'm going to spend a bit of time with that. Damaged sperm ducts, testicular failure, ejaculatory disorders, and life-threatening disorders. So with the low sperm count causes, number one is a variocele. All right, all this is a varicosity or varicose veins around the testes. That's it. That's all it is. It's really treatable with microsurgery, no big deal, and then this could possibly take care of the issue. Remember, guys make sperm that mature in 72 hours, so they can just pump some more out, right? Women are born with all their eggs. That's it. That's all we got. And we have to be happy with that. Number two are hormonal problems. And I'm going to talk a little bit more about that in a second. Excessive heat is a no-no. So that might be, you might need to do boxers instead of briefs. You might not have to work out so hard or go into a jacuzzi or sauna. The other aspect is not only heat from like something like a laptop and proximity to the genital region, but are also EMS from cell phones. So think about where guys carry their cell phones, right? They just stick them in their front pockets. No, not if you want children. So you have to think about these things. Either turn your phone off, put it on airplane mode, or don't wear it on your body when it is on. Numero uno, no matter what. There are other things like hormone disrupting chemicals, which can be a problem. those are usually xenoestrogens. So they start feminizing a male, and that can come from things like dioxins and PCBs. Those things you might find in seafood along with heavy metals. So that's another toxin laid on top there. And also plastics. Plastics are full of xenoestrogens, body care products. So lotions and potions and shampoos and colognes with phthalates in them, anything with a fragrance is so detrimental because it usually contains things like xenoestrogens. No, we do not want those. Believe it or not, statins. All right, how many guys are on statins for high cholesterol? But what they don't realize is that we need cholesterol to make our hormones. So if you're decreasing your cholesterol, you're going to decrease your hormones, full stop. And here's the thing, is we all make cholesterol. The whole statin thing just doesn't make sense. Go find a documentary called Statin Nation. I also did a broadcast about heart disease where I talk about cholesterol. It's kind of a big fallacy. Sorry. It's really more about inflammation for heart disease than anything else. Cholesterol is not the bad guy. He's just doing his job when he plugs up plaques. Speaking of statins, along with those, high blood pressure meds also make the sperm not be able to bind to the egg. Marijuana lowers testosterone and lowers sperm quality. Cigarettes decrease sperm count and motility. They make the sperm abnormal. They affect a pathway in the brain that has to do with hormonal production, which stimulates the production of sperm. So no cigarettes. Alcohol decreases your hormone levels and affects sperm quality. If you are a guy with a beer gut, again, you have more estrogen in your body because fat makes estrogen. So you start feminizing yourself. This is why guys with beer guts often have man boobs, right? There's no really great way of saying that. Hormone disrupting chemicals, again, those xenoestrogens inhibit the development of something called serotoli cells, which determine a guy's lifelong capacity for sperm production. So get the chemicals out of your life. Go to ewg.org, look at everything that you have in your house, get it out. I'll also put a link. I've done talks on this before, so I will look for the links for that and put them in the description. There's also a couple of herbs that affect what goes on with fertility. So sometimes guys take saw palmetto for their prostate. Well, that's going to lower one type of testosterone called DHT, which is important in sperm production and ejaculation. So you have to be careful about that. And St. John's wort, echinacea, and ginkgo decrease egg penetration ability. So again, if you're taking any herbs, you might want to see if there's any effect on spermatogenesis, which is the development of the sperm. So when guys come in, if they come in, because usually it's the woman coming in, sometimes a guy will come with them. Sometimes we're doing this from afar, so I'm kind of helping them out with testing and with what I'd like to do. But if a guy comes in and as part of a couple, he wants to get pregnant with his wife or partner, then I'm going to do my thing. I'm going to do my history to look for any of these causes for what's going on in the body, and the physical and chiropractic exam, because the nervous system controls the hormonal function. So this cascade event, this orchestration of the brain has to stimulate this thing called the pituitary to tell it to produce hormones, which stimulate the other parts of the body, which do things like make sperm. The nervous system also has control through the autonomic nervous system. This is the automatic system of the production of the sperm in the testes, and then also through the sacral nerves, the parasympathetic system, which is the calming, relaxing, resting, digesting aspect is what's going to help the ejaculation. So you need this concerted effect that is neurologically related to the hormonal system, and this is where chiropractic shines. So I'm looking at the stress response to make sure that there is no stress affecting how the body's functioning. So I do that. I'm going to look at the testing that they've had done through their medical doctor with their sperm analysis and culture. Maybe they've had a sperm penetration assay and other antibody tests or whatnot. I might run some blood tests just to get an overall view of what their functional status might be. And then on top of that, I might do some hormonal testing to look at their testosterone levels, cortisol levels, estrogen, LH, FSH, all of that good stuff, as well as DHEA. And then I can make some recommendations based on what I see. A lot of times it means that they are going to have to do some lifestyle modifications. And usually that revolves around getting to bed a little earlier, watching caffeine intake, and also mitigating the electronics that they're using so much, and especially having it on their bodies. So you can turn your Wi-Fi off at night, put things in airplane mode, and get all the electronics out of your bedroom so that at nighttime your body can rejuvenate, repair, etc. All right, we've got some time to go into the male nutrition, and then that should be good. So there are actually some things that have been done and studies, believe it or not, with male nutrition. And the first thing is essential fatty acids, because you want proper membrane fluidity and energy production in those sperm cells. So you want to stay away from fried foods, fast foods, and trans fatty acids. And you want to do more things like DHA and EPA and omega-3s like flax oil and walnuts and pumpkin seeds and that type of thing. Carnitine and arginine are two amino acids that affect motility and sperm maturation. Zinc is helpful because they find it in high quantities in sperm in the prostate. So by default, we know that it's possibly helping. Methylated B12 is great for helping with cellular replication and DNA and RNA repair. And this is your genetic code and communication. And it also helps the sperm count and the motility. Antioxidants. All right, this is a huge one. So antioxidants actually prevent the body from oxidative damage, which ages us. So the more we're aging our cellular structure, the less the function will be, and the less we will be able to have that best sperm meet the best egg and create the best baby. So you can do things like glutathione, selenium, coenzyme Q10, having foods that are high in antioxidants like blueberries and goji berries, and there are actually some essential oils with amazing high antioxidant capacity like clove, which is like 1 million, I think. Stay away from peanuts. They contain aflatoxin, which makes sperm abnormal. And nothing with food coloring, really. Just stay away from processed foods because the food coloring harms testicular function, sperm count, motility, morphology, like everything. It's like poison for sure. All right, that's it. Male fertility in a little nutshell. And no pun intended. Sorry, it's been a long day. And maybe next time I will talk a little bit about female nutrition for fertility, because I did not get to that last week. So let me know what you think. Please give me a thumbs up if you liked what I had to say. Share with your friends. Subscribe so you know when I'm putting an episode out there. And I hope you have a great week, and I will see you next Tuesday. Bye.